Hello, everybody. Welcome to another episode of Health Hustle Chronicles, where the grind meets growth in the world of healthcare. As you know, this ain't your typical podcast because I bring you some of the freshest, livest guests from around the world who spotlight their success and their hustle journey. Today, we got a very special guest who goes by the name of Herron Mitchell. A little bit about Herron. Herron is the Chief Operation Officer for Foremost Family Health Centers. He comes to the organization from Parkland Health, where he served as a community-oriented primary care director of practice operations, also known as the COPC, from the southern region of population health. Herron began his career in the automobile manufacturing at General Motors and was offered his first position in healthcare at Bald Ridge award-winning hospital, Heartland Health in St. Joseph, Missouri. There, he worked as a Six Sigma black belt in the performance improvement department of quality, safety, and risk. He was then recruited to Parkland Health as a project manager and subsequently the director of operational excellence. Herron is a native of St. Louis, Missouri, where he and his wife, Tamika Mitchell, were born. They began their relationship and completed their undergraduate degrees at the University of Missouri, Kansas City. Kansas City, as you well know, has the best barbecue in the nation. He said facts. And the two-time winning Super Bowl champions, the Kansas City Chiefs. They have 3 children who were born in 3 different states during the family's 8 relocations to include Missouri, Michigan, as well as Indiana. Their 2 daughters go to HBCUs, Grambling and Harvard, respectively, and are currently in graduate and undergraduate schools. The last but not least child is currently a sophomore in high school. He will begin driving in a month. That is also a warning for everybody else that's out there is going to be on the roads with him. Han is a bourbon and cigar enthusiast who loves sports, science fiction, spaghetti westerns, and first-person video games. So let's put our hands together. Let's welcome Herron Mitchell to the show. Welcome, man. Welcome to the show. Good to see you.
Hey, Pat, how you doing? Good.
What's that?
I'm glad you invited me. Thanks.
Man, I'm happy to have you. Listen, it's not every day we can get a very own chief operations officer from a health system on the podcast. So when the opportunity presents itself, I definitely wanted to take full advantage of it, man. So welcome to the show.
Thank you. Thank you.
So let's kick things off, man. Let's allow the world to know who you are. I mean, I know a little bit about your bio, and it kind of goes into a little bit of this personal and some professional. But before we get, to your professional background, personally, who are you, man? Tell us.
Well, I'll tell you what. A lot of it you covered in the bio, which was great. But I'm just a person who has, at my soul, a need to help other individuals. Okay. I'm also a problem solver. So when you bring those two together, healthcare is a great field for me to be in as an administrator because you're helping people with the greatest need that need you. And there's a lot of problems that we have to solve within healthcare.
I think that's an understatement, but yeah, go ahead.
Yes. And I'm a fun-loving guy. I tell my staff all the time, I'm probably the laziest person they work with. And let me just try. It's a running joke.
Okay.
You want a person to be in charge of your performance improvement. They do not want to repeat things over and over. So I use that as kind of a joke to say, I have an innate in me to not do things over and over again, to not be inefficient. So I'm looking for always inefficiencies because I want things to run as smoothly as possible.
Listen, I like that then. I mean, snap, I got to be a lazy leader as well because
laziness and performance improvement.
That is awesome. Listen, just reading your bio, I mean, getting you in that journey, we're talking about all these different states. We're talking about raising kids. We're talking about, started and then transition to a large health system in St. Louis and then navigating to Parkland. And then here you are at Foremost. Man, that hustler's journey is real, man. It's like that Star Wars force is fierce. So tell me about this journey and your hustler journey, because that's what people like to talk about. We want to get inspired by how you got to where you are today. So give us some insight on that, man.
So, I took the traditional path to get here.
No.
And kind of my has not been traditional. I actually got my degree in biology because I thought I was actually going to go into healthcare probably as a provider or physician.
Okay.
But I ended up going into manufacturing. So that was the first thing where my parents were like, okay, we'll support you on whatever you try to do. Well, the thing about it is I always run toward where there's problems and there's issues. So in this non-traditional path, when I started in manufacturing, that's where I started. I started building databases at General Motors in the maintenance department. And there they had an issue with trying to classify all their supplies and all their tools. So I helped them out with that, which was a great problem to solve. And then GM kind of kept me on because they were like, this guy has a little bit of something.
Right.
But at the same time, as I'm going through those office positions, there's always a hunger to do more, to be where the fire is at, to really problem is at.
Okay.
So I said, hey, what do I need to do to advance? I want to go to where the action is at. And they said, we're going to send you to the plant. And the first plant I went to was Detroit Hamtramck, and that was an eye opener. Every day, every minute was like, it was fast paced, and you had to make sure the line was up. And I had some great mentors and advocates out of that. And it's like the Brer Rabbit, which I also joke around about. And it's one of my favorite stories about Brer. And I would, viewers to go look it up. But essentially, this rabbit talked these two wolves from eating him by saying, put me in this place where nobody wanted to go. So they thought that putting him there was worse than eating him. Right. But that's where he wanted to be. So that's kind of where I ended up being in the plant, where people at the office were like, oh, don't go there. You have a horrible time. I ended up loving it, ended up excelling, picked up a lot of transferable skills that now that I went to healthcare, one of which got me the job, which was an understanding of Lean and Six Sigma. I'm using those all the time. The stuff that I picked up in manufacturing, I'm able to use in healthcare, and I just continue to build on my skill base and continue to take on more responsibility as needed to help the people out there that need our services.
Give us some insight into, because that's a word, and a lot of us, we hear Six Sigma, black belts, green belts, all the colors. Can you shed some light? What is a Six Sigma belt? What does this mean?
So Six Sigma black belt it's a methodology that was actually developed by Motorola. And it's really built on data and built on statistical control. So you're looking at a process, and what you're trying to do is reduce variability. And that's really what Sigma means. Sigma is the Greek symbol for deviation. Okay. That we use in math. It's like the standard deviation. So it's a sigma. So you trying to get to the Six Sigma level, which is actually a number. And it's like, if you take it, it's like 34 problems per million opportunities, which is a number. You never can get to zero, because if you think about a standard curve, it comes close to the x-axis, but never touches it or crosses it. Okay. So at the 6 standard where you'll see a lot of industries, like the airline industries, in terms of crashes, that is a Six Sigma level industry. They do a lot of things to prevent those things from happening. So healthcare was really looking for, hey, if we apply some of these things, maybe we can reduce our error rate. So where do you go to get people like that? Well, you go to manufacturing, because they're using that not just as a project. We're using it as part of our business, because we're looking for decreased tolerances and things like seatbelt safety and things like gaps you see in doors to make the cars safer, to make them look better. So it's a methodology based on a statistical analysis to reduce variation. On top of that, you have Lean. Now, okay. Lean comes from Toyota. Now, General Motors would not call it Lean at the time. It was Global Manufacturing System. But Lean is really the concept where you're looking for reducing waste in a process to make it more efficient and make it more valuable for the customer, so that when you're spending money, internal money, it's spending at value for the customer. And a lot of that means that we have to listen to the voice of the customer, because a lot of times when we go into talk about these, even in healthcare, what's best for the patient, what's best for the customer, we never really ask the customer. So Lean is a way of thinking that it came from Japan, and they developed because they needed to understand what the customer really wanted. And so once you start understanding what the customer and the patient really want, you start to really tailor your processes for patient satisfaction, for customer satisfaction. And really, it helps you as an organization, because you're only spending money on those things that are important to the customer, which is valuable to you as a service provider.
So you already had this certification before you entered healthcare, is what I'm understanding?
I did. I got it from the Society of Manufacturing Engineers, a Lean certification. And then I also was a certified Six Sigma black belt from the American Society for Quality.
That sounds like you're just good at jujitsu and karate and everything. That's what it sounds like, man. That's what I'm picking up on.
I'm not good at jujitsu at all.
Okay. So you ended up getting this certification. You was working at General Motors. You wanted to be in the darkest place in the factory so you
Yeah.
could pick up and learn some of the toughest skills. And it sounds like you did that. So then what? Now what?
So then General Motors kind of went through a downturn through the economic crisis that we had, and so they were asking people, "Hey, do you want to take a contract?" And I said, "I really look at something different." So I
Yeah.
went and I actually taught high school for a year, and so in this, my family, we always move around because we actually go to this opportunity. So
Right.
I taught high school for a year, but I ended up, it was in Texas, and I ended up having to go back to Missouri. So looking for a job, that's where I got into healthcare. And as a Six Sigma black belt, and started working on a lot of these projects. And what really interested me was population health.
Okay.
Population health and preventative medicine to me is where it's at. And because you really want to have a kind of your hospital network, because you don't want people to always go to the emergency room or have to go into the hospital for a high acuity visit. You want to make people healthier so they don't have to do that. And if
Okay.
you think about that as a health system, that's where the lower cost is. If I can reach you before you are uncontrolled diabetic, where you have to go in for surgery to take off a limb or something, if I can impact you where you're at your house, the way you eat, the way that you exercise, the way that you take care of yourself, you don't have to go into the hospital. And this directly impacts everybody. It lowers the cost of healthcare. The insurance companies have to pay a lot of premiums out, and it makes people healthier. It's the way to do it. So preventative medicine has always been the thing that's really interests me. But the money goes to, of course, high acuity care because it is
Sure.
costly. But that preventative belt around the healthcare system is actually where we need to be to solve problems, to keep people out of the hospital. So I got interested in population health, even as a Six Sigma black belt working at Heartland Health. I helped them bring on their Affordable Act primary care kind of model where they had a patient-centered medical home. And so building that process really got me more entrenched in that, so that when I got to Parkland and I was working in the hospital doing a lot of hospital projects, but still internally in me, that fire was for ambulatory services. So I had some advocates that said, "Hey," I went up to them, I said, "I would love to run one of your clinics. I would love to be out there because that's where, grounds I think we need to be." And I had some people that believed in me, and they gave me a shot at running clinics. And then from there, it was like wildfire. It was like gas on wildfire, because I'm still, my heart still beats when I talk about population health and preventative medicine, especially in the zip codes that need it the most, where you're seeing people with food insecurities, where you're seeing people with, maybe levels, high unemployment, homelessness. That's where we need to be, and that's where I thrive.
Wow, that's impressive, man. It sounds like, just listening to you talk, you exemplify, I guess, the terminology of a servant leader. Like you want to give back, you want to help others, and you want to put yourself where other people don't want to be, so you can make the biggest impact. Is that what I'm picking up on?
Yes, I would. I use it as a model, being a servant leader, not only for the community but also for my staff. I like the concept of, if you walk in a room and you see me and my staff talking, you don't know who's the leader, because they have a high competency. They can talk with me. I bounce ideas off them. I'm being a directive. I hear a lot of things from what they say, because as a leader, I feel you need to listen to your front line, because they know where a lot of the problems are and they're ready to bring those to you. So I'm willing to try new things with them. And so from that aspect, I'm a servant leader. And also in the community, I want to, bend for the patients, because these people, they are living in a condition where, they make sacrifices. Even to come to the doctor, they
Sure.
have to make sacrifices. So when they come, I want to make sure that I'm providing them with world-class care. And that is making sure that the visit is efficient and effective, making sure that I'm supporting my caregivers, the doctors and the nurses that have to see these patients, and making sure that they feel wanted as a patient-centered medical home, is that it's patient-centered. Everything from the time you make a schedule to the time you leave out the door, everything should be patient-centered. So in that aspect, I think being a servant leader is the best model out there.
I love that passion and focus that you speak when you talk about the patient-centered care. I mean, me from the outside looking in, I can only imagine, that you're making in these facilities that you've been leading. Speaking of that, before you became a chief operating officer, you spoke on that you was with Parkland. Help me understand what that was like, because you were there during the pandemic. What were you doing, and It's like, how did that impact, how you're a COO today?
So, very good question, Patrick, because it did. The pandemic changed all of us. That was one of those things that caused disruptive change.
Right.
And in the healthcare industry in general, you have to look at how you're dealing with staffing. You have to look at how are you dealing with how are you delivering care, because a lot of it couldn't be face to face. So Parkland is a great hospital, one of the biggest safety net hospital in Dallas, DFW, and maybe in it's nationally very, very big. I think they have the busiest emergency room in the nation. But what they were challenged to do was not only deal with what was going on internally at the hospital, but also what was going on in the county. So actually, we formed a partnership led by the city of Dallas and the county, the Dallas County, with the county commissioners to set up community-based testing sites at 2 locations that were mega sites. So one day I'm sitting on my porch and I'm just, kind of business, having a cigar because I love. So I get a call from the CEO of Parkland. He's like, "Herron, what are you doing?" I'm like, "I'm relaxing." He says, "Come see me on Monday." It was on the weekend.
Ooh,
And so I
sound like
came.
you're in trouble.
I'm going to put you in charge of, leading to set up these 2 sites. And for the next 2 years, I was involved directly in building up these sites, working with FEMA, working with the city of Dallas, working under the command structure of both Parkland and the city of Dallas to stand up these sites, working with Dallas Fire and Rescue, the Dallas County Fire and Rescue, that multi-county response from them. And all of them were heroic. Working with individuals, health caregivers at Parkland who were sent out to the sites. And we were at ground zero.
Right.
People were scared. You don't know what's going on really at the beginning. We're getting operations from the government that we have to massage. My team was brilliant. If you have brilliant people around you, you're very successful. So as a leader, really, all I can really take credit for is putting together that team and then backing them on some of the decisions that they made on how it should really look, how it should really run. I had a counterpart that actually went out and ran the other site. We became peers. And then after I got tired, she took over. So, It's like you got those people that are really champion these things. Anything can be done. And, I talked about that team as the years go by, and we sit and laugh and we like, how did we even do that?
Exactly. Right.
How did we even do that? But we just took every hour by hour, every day by day. And we went from, maybe seeing 100 people that needed testing to, at the height of testing, seeing 1,000 people a day at down at either side, at the Mavericks, at American Airlines, and at Ellis Davis in South Dallas. Then I kind of they switched to, when my counterpart took over, I took a back seat and they switched to vaccination. I still hung around to help, but it just it was like a family environment, and we fought and we had different ideas. But when we came out the gate, we were together and we just made that happen. And we saw 1,000 people. At one point, we broke a record at American Airlines. Then they broke it at Ellis. And so we just, that really rewarding experience. So that really, even though I had that fire to help the community, being there at ground zero and seeing the people roll up and go through that, and they being scared, but you've been able to provide them with some type of, a comfort. They had COVID or they didn't, so they can talk to their doctor about the next course of action, was really something that kind of catalyzed me. Like, I can do more. So, and they always say, be careful what you ask for, because you're going to. So now I'm right back in 215, working at this great Foremost Family Health Center, right in the shadow of Fair Park, dealing with the same type of individuals, trying to provide them with, ways to healthcare, even if they don't have insurance. And that is something that has, kept me fulfilled as a administrator.
That's quite a bit. That sounds like, okay. So during, you were setting up sites, you were seeing it, it's some 1,000 people a day. And at some point you transitioned to vaccinations. Talk to me about like your fear level. I know in the very beginning, no one knew which way was up, which way was down. Everybody was all scared. We was talking about PPE and, having supplies. We didn't even want to be around people. It's kind of like, which was so. Talk to me about, how to ground that fear and
tell you, man, and you're a veteran. When you're in combat or when you're in a situation like that, some people are paralyzed by fear, but some
Right.
people run into it. And so that catalyzes you. And
Okay.
that's what I'm saying. Afterwards, you're like, whoa, that probably was a little bit risky to be out there, and you
Right.
don't really know. There's like cover your. You don't really know what it is. I was happy that none of my team got COVID until actually we were really, really later on in the project,
Right.
and we were just trying to do safety protocols. But at that time, you're so focused on implementing the process and making sure that everything is running. And you have these situations come up. You're talking about supplies, like running out or just nearly running out of supplies, or not being able to make a deadline to send the samples off the lab coat, because you know you have at the end of the day a deadline to get it on a plane to get it somewhere in the nation so that they can make these finish these people know that what their status is. And that's what you're focused on. And you're so focused on those types of things that the fear kind of dissipates. But later on, it comes back. Like,
Okay.
so for this, we got a second of rest. So really, it wasn't until we kind of were years. We're like, we went through some traumatic things going
I would
on.
imagine. I can only imagine.
Come to work. People lost their spouses during this time. People lost their loved ones during this time. People, we had, when they first came out with the specifications, some people were able to get it, some people weren't. But you just focus on the task at hand, and if you have good people behind you,
right,
and you're back to back with good people, they got your back. And so that's what we did. We had each other's back. So if there was any fear, it really never came out, because you didn't want the next man to have to go down, because you were ready to pick him up.
right. Two big things that I picked. One that you said earlier is that if someone walks into a room and they see you with another one of your employees, that no one knows who the leader is. Like, I found that inspirational and impactful. I'm thinking, wow, if you think about that, like, that's pretty cool. Like, I picked up. And then the other thing is, you was talking about fear, how to overcome fear. And for you is by having a process. So if you created a process, you stuck to the process and you followed it, basically in that action, because you had those steps that you're following, it prevented you from being fearful in those moments and allowed you to take some steps forward. So did I summarize that pretty good?
That's great, man. And again, I cannot stress the team around you. Okay. The good people around you. That's one good aspect of a great leader. I've worked with some great leaders, and the real ones, the really good ones, are able to put together a multidisciplinary team. I worked with the gentleman that hired me for Parkland Health, was one of those people. Able to put together, you would look at it and be like, on paper, be like, how do these people get along? Right. But together, we were a solid team, because when it came down to recognizing what the issues are and putting together our differences of background, differences of education, that is what Parkland needed at the time. This team of diverse people and diverse ideas to come in as change agents and help the clinic. And this gentleman was really good. I learned a lot from just him. He did it. He was actually one of my mentors, one of my biggest advocates. One of the other advocates was a gentleman who was a veteran also at General Motors. He kind of was my feel of what advocacy could do. And this was one of the guys where you would look at him and you'd be like scared to approach the guy. It didn't seem like approachable. He never had a smile on his face. Well, he was a funny guy, but he never really, you're like scared up to him. But what he did was, when he recognized that you were serious about your job, and you were ready to lay it on the line every day, and you had your people's back, he would start to pull you in and start to give you some advice. And then after he saw that, hey, this person's listening to it, he would advocate for you. That was really working at General Motors. When I went to the plant where everybody said, don't go there, don't go down there, it's terrible down there, I actually got my first promotion ever in life at Detroit Hamtramck because of him and advocated for me. And I learned so much from him. I learned that the mission was very important, but also the people are very important. And how do you treat the people? And how do you act? It's not necessarily that you have to be, if you're not the nicest person or whatever, but you need to be consistent. You need to be fair. You need to be ethical. You need to be, and what I mean by consistent, if you have rules, lay the rules down and then set some expectations, because your employees are watching you. They're watching that you're making sure that you're treating everybody the same way. And so I learned that from him. And I learned that there was never anything that he wouldn't do for me.
Right.
As his employee. He had my back all the way. And sometimes I got in trouble. I remember one time I was a young supervisor, and we were running low on parts. And I'm sitting in my office just chilling. So the line is down. So he calls me on the radio. He's like, "Hey, did you ever get those bolts in expedited?" I'm like, "Yeah, they're going to be the doc." He said, "Do you have them?" He said, before I can say anything, he says, "I know you don't have them because I'm standing over here with them." So
Oh, wow.
fucking rolled over there and he like let me have it. And then later on in the day, he comes by my office. He's like, "You all right?" I'm like, "Yeah, I'm all right." He's like, "Now you know when stuff off expedite, you need to be on that because we can't as you know in General Motors when the line is down, everybody needs to jump on that." So he raised my level, and from then on, if expedite shipping was there, if nobody else was there, I was there.
You was there. You was
I would drive outside the plant and meet them at the gate.
That's awesome. I love that. So listen.
He he forced it with us anymore, but I learned a lot from him in those plants at General Motors. Yeah.
There's so much in this conversation that you just had. Like there's so many ways that I can go with this, but so I like the fact that you spotlighted you had coaches and mentors who influenced and held you accountable that helped you reach this level of success that you're at now. So I appreciate you sharing that. The other thing that I picked up on, and then I'm gonna have a follow-up question, is that it's okay to have a supervisor that's tough on you. Because I think nowadays, like we as people, it's hard for us to accept criticism from someone that's over us, but you took it, and because of that, it positioned you to strengthen your skill set and held you accountable. So I got that from it. And then the other thing,
I want to jump in here.
Okay, go ahead.
Because that you really summed that up really well.
Right.
And it's not only that you're willing to listen to a critique, but what proves it to me, because I'm dad, always looking for the logical next step.
Sure.
What proves it to me was the outcome in my career after I took that critique to heart. And I really said, okay, let me change that. And I got better. And I started getting more skills and I started getting more levels. So that's feedback. If it's good critique, even if it's negative and you take it on and you start to do one of these things, with the trend curve, I mean, ask for.
That's powerful because, I was in a conversation too with my wife a week or two ago, and we were just talking about feedback, whether or not it's valuable. And, we both the conclusion that any feedback you get from a supervisor is valuable. And the fact that the minute that they stop providing feedback means they've lost confidence in you and they're probably moving on from you. So we should seek to get feedback from our supervisors. Would you agree with that?
Well said. You should seek out. I tell the people I work with right now, even in my departments that I serve, other than the departments that I'm over, I look for negative feedback. That's and awesome. In high reliability organizations, which is another theory of improvement in culture, and you look for error. And I read a good book about high reliability, and so the book basically said, the old news is good news. Well, with a high reliability organization, no news at the very least means you're not getting any feedback.
You're done.
At worst means that something has happened and you don't know about it.
Right.
It's never good news when you're not hearing from the environment or the staff or the patients where you're going. You need to be able to be at a place where the environment is giving you feedback. Just like lean, when you're talking about visual management, you should be able to walk into a room and tell with lean tools that stuff is out of place, stuff is missing. And that's how you make things more efficient. That's how we get world-class, effective, safe, timely, and patient-centered.
Good stuff, man. You dropping all kind of nuggets today. This is great. I can't wait for this to be reposted because I know, man, I'm going to get all kind of comments on this particular topic, especially speaking with you, someone who's been through the trenches, doing these stage camps provided. And now we're talking about analytics. Speaking of that, so we went through the pandemic. How do you think the health system has changed since the pandemic to where we are now? And that can be from a leadership standpoint, from a technology standpoint. Just give me insight. What's your thought on that?
Wow. Like I said, that was a disruptive innovator. The pandemic forced us to do a lot of things. So first of all, virtual care has got hot.
Okay.
You have to always go to face-to-face with a provider. And that's opened up many, many other paths. So let's take that to a level where maybe you're in a rural area. So now, instead of having a doctor at an office and you got to go to an office that maybe it'll take you an hour or 2 hours to get to, I can put a doc in a box, what they call it, for lack of a better term, with maybe one support staff and a television. You go in there, the nurse in there, the CMA takes your blood pressure, and then the doc gives you a telehealth visit. The doc can be anywhere in the world.
Oh,
Anywhere in the nation, anywhere in the world. But you can put these things relatively low expensive because all you have is really the overhead for the site itself and the support staff. But the higher valuable asset that's more expensive, you can have this person sitting in for, if let's say if I had 6 locations in Texas, I can have them in Oklahoma, one person over 6 of those locations, and they're just sitting there and they're just doing their work. They're going to each of the clinics, but they don't have to go there.
that's
Also,
awesome.
you can have specialists talk to your primary care network. So
That's,
let's say that there's some things that your primary care doctor says you need to see a gastroenterologist, or maybe they need some help controlling your cholesterol. You get with a specialist. Specialist talks directly virtually with your primary care provider to get them to the top of their licensure in terms of controlling your chronic disease. You don't necessarily have to go see the specialist, but then they can see a lot of other places. This was a model that I studied in when I was doing my master's. And actually, I don't want to say it started in India, but the model that I saw was from India, where they
okay.
had this kind of system of, you had a spoke and wheels. You had, in the center, you had a specialist or your high valuable income, your high net provider
Right.
in the middle, and then you had spokes to the individual nodes where you can have the patient sitting anywhere. And so now that's what COVID did. COVID actually made that where it was very valuable to do things. So what did the government do? The government is now trying to, how do we incentivize that? Where does that fit at on the pay scale, and where fit at in the continuum of care? So at the same time, as you can remember, we had the ACA that was happening a while ago, but really through COVID, really the conversation really got going. How do we make the people healthier? So on the other side of COVID, you have the value-based care. So now, the switch from fee-for-service to value-based care. And what that means is we're looking at things like clinical quality measures, where if you're a diabetic, how's your HbA1c? How's your high blood pressure if you have hypertension? Are we making you better? Or are you just taking these cycles where you come to the clinic and you go to the next doctor's visit, the next doctor's visit, and you're not getting any better? So they're not incentivizing that for us anymore. They're moving away from that, which is a great model.
Sure.
We should be incentivizing places for making people better. And that goes to where we're talking about population health and preventative health care. So now the insurance companies moving. So COVID did that. COVID kind of switched where should we be really incentivizing these things so that we're dealing with population health. Also, how are we building clinics?
Okay, talk to me.
From the old style of, just throw some exam rooms in a 4, a brick and you're okay. No, not now. Your clinic needs to be flexible. You need to be able to maybe you have 10 exam rooms or 20 exam rooms in your clinic. You need to be able to flex up. During the pandemic, you meant to flex up some of those offices where you have your office staff. You need to be able to make those exam rooms. You need to have a side entrance so people can come in and decontaminate. You have to have an entrance for where people can access a drive-through, because sometimes in these pandemics, you can't, people can't come to the clinic because you're communicable. You make it sick. So these clinics, we have to build them that way now. We have to build them so they can flex to these different things. And we know there's going to be some type of other event that's going to come and tax our society. But now we know, since having the COVID, we know that these are some of the things that we need to do. These are some of the things that we need to have on hand. We need to have maybe some hazmat suits. And the hospitals are really good at this already. They're already prepared for a lot of mass casualty disasters. But the ambulatory setting maybe was really not. Do we have negative pressure rooms built in? Do we have isolation rooms, real isolation rooms that actually are, will prevent people from coming into harm's way? How are we going to protect our staff? Yeah. And all these things are just 3 things that come to my mind. But government regulation, how we spend our money on our clinics, COVID put it right in our face. Staffing, the fact that we're headed toward a cliff where we're not going to have enough RNs, we're not going to have enough MDs. And how do you deal with that staffing model where you have a lot of travelers, where it gets very expensive,
right?
Kind of like bidding against staff. So, and in Texas, they really have stepped forward in Texas because they are actually addressing the number of seats that are available for nursing students. It's very hard to get into school because there are not enough seats. But like when nurse, which is the reason why I like healthcare. But when she went up, they had these academies you go to, where there seemed to be more and more of those. So it's how, and the government was putting resources toward those to make sure that we had a stable nurse, environment, a number of nurses that can come in behind the ones that are retiring. So we have a lot of things to do. Healthcare is, really, I say that it was God's work, and it is. It is caring about people to the nth degree. People in healthcare, normally at the very core of them, is about how we care about the human race. But we have all these things coming, and as a problem solver, I can get excited about that. It doesn't scare me. It means I got a lot of work to do.
Listening to you talk and just your passion and the insight, dude, it's phenomenal. It really, really is. From the outside looking in, I mean, I love you talk about not only your experience, but kind of where the health industry is going and how technology is playing a fruitful role in the development and the care. Like, it was just you explaining about how to set up a hospital and having these side entrances for contaminated people and people that need wheelchair access and all this good. Dude, that's some really deep things, man, to be thinking about. So, and the fact that I guess you talked about your Six Sigma background and how that has played a role in shaping how these set up, but how we're thinking about these new facilities as they come on board as well.
My manufacturer, actually, that's cool you brought that up, because my manufacturing background helped me with the community-based testing sites, because really it was like a conveyor belt.
Right.
When we had the people come in, we had them come into different stations. It was just like building a car, man. I was happy. Kind of fun to bring kind of skill set back in and look at throughput and productivity that way again. But those types of transferable skills, and I would tell people that are looking into going to healthcare, and you are in healthcare and you are a veteran and you in the military or you in some other environment, look at your transferable skills, because you'll be surprised at how much of that you can bring into medicine. I use stuff in manufacturing all the time when I look at my operations. It's all about being more efficient. We talk about doing time studies. That is the backbone of building automobiles in America, is how fast we can do it, how safe we can do it, and get the customer needs determined by what they are telling us, what they want in the product. And the product in this case is a healthy individual. When you're coming in, if you're waiting a long time, that's a problem for us. We need to get you as quickly in to see that doctor as possible and make sure that you have everything you need to be as healthy as you can.
I'm glad you said that, because as a patient that walks into a medical facility, I'm like, dude, why am I waiting here 45 minutes to an hour? My appointment was at 11:15. Why are you just now seeing me at 12:20? Like, what's going on?
It's a problem. Waiting is lean, and lean itself, the ideology, the process of waiting is exactly what you're trying to avoid.
Oh, yeah,
so those things were to minimize that time. I actually had an opportunity to work directly with Toyota at Parkland Health in the emergency department. And they came in and helped us. And the way they did it, again, that's a servant leadership type structure, because when you meet people who are really believe in lean, what they want you to do is for you to learn. So they will come in and give you the tools, but they don't necessarily tell you what to do. They just kind of say, okay, you may want to try this, you may want to try that. And they're trying to teach you, because that's really the win. Right. If you can come in and teach a small team of people in an institution how to do lean, and then take those people and seed them in different departments, and then now those people learn how to do lean, in a couple of years, you have a lean organization. So now people are walking around doing lean projects just off the top of their head. I want to move the printer because I'm walking too far. Well, every second you get on every patient, that ends up being hours. And so that's what you're waiting on. You're waiting on stuff that you don't want. And that's what I'm talking about. When you talk about what the patient is willing and not willing to pay for, when you go someplace, you are not willing to pay to wait.
No, not an hour, man. You're like, man,
I want to pay some more money so I can wait a long time. No. So that's exactly what lean is there to shorten.
I think a grace period for most patients, if we walk in, if we have to wait 15, maybe 20 minutes, it would be top. That would be tops.
That's a long time. Yep.
Exactly.
Yep. And it's also your perception of waiting. Press Ganey really does very good with this in patient satisfaction. That's one of the dissatisfiers, the driving dissatisfier is waiting. But waiting, if you think about it, if you wait when nobody's talking to you, it seems like a very long time.
Absolutely.
But if I'm coming out and I'm saying, Mr. Hart, this is where you're at on the list, doctor behind, or this is where you're at, you're up next. We got you. Would you like a glass of water or something? It makes you feel. You can
Right.
wait maybe a
Yeah.
couple
Like,
more
yeah,
minutes.
they care about me. They came out and spoke to me,
Yes,
and
you're
they
not
recognize I'm actually here. Yeah.
yes, they're treated like a person. So
Yeah, I love that.
that we like, please go out to the patient. The people at the front desk, there's not just to check you in, but to manage you and say, how are you
Okay.
doing? And you know what, really, I learned this at Heartland Health because they actually went through a transformation where they wanted to kind of look at the hospitality industry and figure out how do we not so much make this look like a hospital waiting room, but make
Right.
it look like a hotel waiting room
Right.
where it's warmer, and maybe it's not even waiting. Maybe you just come in and just kind of go into. So we used to go out and visit places like Quick Trip. We used to go out and visit
Yep.
Build-A-Bear. Things, places where that do really hospitality really good. Starbucks, stuff like that. Learn and see how do these people talk to the people. What do they talk to? And one thing that we found out is that it is intentional. The things that they do at Build-A-Bear was really neat. Even when you go into Build-A-Bear, if you go in the back, they have on the wall like employee guidelines, but in bear language.
Oh, okay. Okay.
It's like you walk in, even the employee guidelines that are fairly regulated are in
Yeah.
languages like you're at Disney World or something like you
Oh,
talk.
that's cool.
So it
That's
gets you
cool.
in the mood. And so if you're in the mood as an employee, if we're putting this energy to you as an employee, how are you going to interface with the patient or the customer? You do it well. You make it like they're not about you. You make it like it is yours. Whatever is the problem they're having today,
Yeah.
make it go. And that's what we teach.
So let's fast forward to today. So now you're a big dog on campus. You're the operation officer, at a system right here in the Metroplex, right? So what the freak is a chief operation officer? What do you do? Like, honestly, what do you do all day? Like, tell us, give us like, man.
Oh man, what you asked for. So yeah, I've always desired. I told you, can't sit on the sidelines. I can't sit on the sidelines. I got to be in it, and this really puts me directly in it. So, Chief Operations Officer at Foremost Family Health Centers, I am over operations, which includes patient access, it includes facilities, it includes revenue cycle management, IT, any type of renovations that go on. It's in my purview. And then within patient access is when you call to schedule a doctor's appointment, who you talk to get you in, who you check in with, make sure that your consents are signed. All those people work for me. For the RCM, revenue cycle management, when you're done seeing the doctor, it generates a claim. This claim is how we get paid. I have a whole department that's based on getting those claims filled. And so then the other part is outreach, where we're actually going out to the community and making partnerships with people in the community organizations to, one, bring in more patients, but two, also provide community resources for our patients that are there. Because there are resources like findhelp.com, which will help you deal with your situation if you're homeless or you don't have a job or you're starving. We have what they call community health workers that work in outreach who give education to the community on what our clinic is about, but also what's out there in terms of these type of community resources, what's out there for funding sources. If you're with your immigration, they help with it, point you in the right direction there, because that's what's needed.
Right.
We cannot just stay in these four walls anymore. We got to get out. We got to get out and meet the patients where they're at, because some of them can't get to us. And that's not their fault. We have to meet them where they're at so that we can help them. So as a chief operation officer, I'm always thinking about new ways, along with my colleagues, along with all the other chiefs. But I'm essentially the guy that's over the non-clinical side, and I'm helping support the clinicians. So when the patients come in, they're ready to go, and also outreaching to the community. And that's what I do on a daily basis, 24/7 sometimes. And it is a job, my friend. And that's what I love. And that's why, like I said, the fire for operations was lit in me when I went to the production side in General Motors Manufacturing. And this just is another version of that. I love operations. I love to be where I can see if I turn this knob, does the process get better? If something's wrong with this process, how do we make it better? How do I deal with complex teams over different divisions? That's what operations does every day, all day.
Man, that's really cool stuff. I mean, and the other thing too is like, yeah, we live here in the United States, and if you live in a major city like Dallas or Austin or Houston, Philadelphia or something, that you start thinking that the rest of the United States is big and massive like that. But here in the U.S., there's actually bigger rural population than there is a metropolitan population. So the fact that you're talking about getting outside of your four walls, making care accessible in these remote locations, even if you're in 2 or 3 different states over, that's powerful stuff, man. That's making real impact. So kudos to you.
That's what's needed. That's what's needed. And
You
those are
gave me,
we
go
have
ahead.
to protect those. We have to protect those rural and urban health centers that
Yeah,
really deal with people that are on the margins. They
right,
don't have a lot of profit margin.
right.
They're not like some of the bigger systems that maintain this. But these people are we're barely getting our mission out there.
Sure.
So we need to protect those things because that's where the people are. That's where the people go because we're right in the heart of the community. So either some people walk there. Some people will take, the public transportation systems in the rain and the snow.
Right, right,
We're
right.
there. We're there to serve those people.
Awesome.
Mhm.
So, okay, so you're a chief operation now. You gave me some insight on what you do. Help me understand, can you do your job in 5 days, or are you working 6 days, 7 days? Like, or can you do it in four? Like, what is it?
My staff. We're
Right.
on 24/7.
Ah,
We're on 24/7. So and the thing about it is I don't want everybody to think that I actually expecting them to work every
sure.
minute of every day. But
Right.
what I really expect them to do is manage their life and time. I really
Gotcha.
believe in work-life balance,
Okay.
but we don't really have a set schedule because in the
Okay.
middle of the night, the burglar alarm can go on in one of my clinics and my ops manager is on it.
Okay.
So he doesn't really clock in, clock out. But if he's working late at night, I don't expect to see him at the crack of dawn the next day.
Okay.
And
Okay.
that's okay. So really it's about what are the needs of the operation.
Got
And so
you.
sometimes it is a 7-day job, but sometimes stuff is running well. And we can take advantage of that too. And the way that I manage myself is the way that I would like my staff to manage, and I'm there to support them. I think that getting back to the servant leadership,
Hmm.
us managers, if we're managing some employees that have that type of mentality where they're on 24/7 and they're really available. And I say this, and my staff, they're funny, but they do it without me saying.
Oh, nice.
And so what I want to say is I have the expectation that you should, if you need time off to spend with your children, go ahead and take that. If you need me to come in and be a relief operator, I can check in patients.
Right.
I'll do that. That's what I'm saying. You come in the room, you can't tell who's the COO
Got
because
you.
sometimes I'm at the front desk checking in patients with them.
Okay.
So, and if you're going to be a servant leader, you got to be able to get down to the tactical level and make yourself valuable for those people. That is how you make yourself a model for everybody that works for you.
So let's keep it 100, man. We got to keep it 100. So you're this big dog on your own campus, right? And you're telling me how you want your team to, manage their work-life balance on their own, communicate regularly for the greater good and the mission of not only patient care, but for the operation of the organization. But for you personally, how do you separate that from your family, man? How do you have that work-life balance? Because I know one thing as a leader, you can tell your team to do this, but are you able to do that as well?
Yes. It's difficult sometimes.
Yeah.
But it's not only with just that I do, but also looking after the people because my first priority is how they doing.
Okay.
How are they doing? The importance of having routine one-on-ones with people. I shouldn't have to, think about them just when they do something wrong. I'm having one-on-one routines. So we have these conversations.
Right.
We've done the emotional exchanges. I know pretty much about how my staff feels. So just being that sometimes is overwhelming for me because I tend to put myself second.
Right.
Well, as a leader, and you have to make sure that you have to have time. The gentleman that hired me at Parkland Health, he actually is a firm believer in that, and he actually made us schedule lunch on all of our calendars. So as a meeting, so you won't schedule anything over it. So again, I learn from people. I learn from my mentors. I learn from everybody around, and I'm not afraid to take ideas. I have the same thing for them. I have lunch is important as a meeting. So one thing you have to do in the middle of the day, take a break. Take a break to free your mind. Get away. Go outside. Take a walk. So when I'm talking about myself, those are the type of things that I do. When it's time for me to disconnect, quote unquote disconnect, what I really do is I try to put myself in situations which takes my focus away from the job, because I do have those blocks of time where I know I need to mentally disconnect, and then I go back to work. But then when I'm like going on vacation, I usually take a day, decompress, Use it, take a day to, hey, focus. So, I like to go places like if I'm in the Caribbean or if I'm in Vegas, I would take that first half a day. Maybe I'll look at some emails because I'm trailing off. I'm trailing.
Okay, got you.
I'm in a place now has drawn my attention away from work. So that's really the real way to separate yourself when you really want to separate is put yourself in places that draw your attention. Travel to Europe, travel to different places. Go outside and sit in the park without your computer, without your cell phone. After a while, you're going to be listening to the birds chirp. You're going to be in the moment. But it takes a second. And I think you need to be realistic to that. Some people can turn it on and turn it off. I don't necessarily can do that. I have to wean myself away. But once weaned away and something else has my focus, then I'm all in that. Then it's time to come back to work and I'll refocus back up on work. But I really try to put myself in situations so the situation itself pulls me away from the job.
Okay. So, and in that, keep it 100. I got a follow-up question I want to ask you, but I also want to set this up that because half of the people that follow, my podcast actually just from an audio standpoint, and then I have other streaming channels that you can actually come and see this, so they can see your face and they can see our body language, the whole nine. So for the people that are not actually seeing this, I want to point out the fact that you're an executive leader and you're a Black man in healthcare in a metropolitan location. How does that impact you being a Black man, being a Black leader in a major city like that? Or does it at all?
That's a very good. I'm a member of a National Association of Hospital Service Executives, NAHSE. And, that is an organization, American Executives, Hospital Executives, and we share ideas. Okay. I was just at a panel discussion last night about this. And it does affect you as a Black person in America because you have the history, and you can't that down, right? Because everything that I do on the shoulders of people that came before me. Mm-hmm. Even with this most important election that came up, I told everybody I'm going to vote because hey, those people before me that laid down their lives so that I can just be counted as an American citizen. Right. I owe them a debt. So those types of things are why I do what I do. And you take that into kind of your administrative role. Color, you're looking at communities that are affected by major health adversities. So in Dallas County, where I work, if you live south of 30, 35 there, you're expected to live 20 years.
Wow.
Because of the location. Wow. And so that is something that it really infuriates me. And I can't see how any reasonable person would not find that terribly troubling.
Right.
From and the framework, like a 5-minute drive. Yeah. 5-minute drive from Turtle Creek to down to South Dallas. Right. You're talking about 20 years. And so those types of things, it really is sensitive for me because I'm looking at people that look like me. Yeah. And they're not living long as somebody who just lives up the street. Wow. So those types of things, you take that and we were talking about how do we build strategy? How do we look at as an organization impacting those areas, going into those areas of need? Where do we need to go? How far south do we need to go? What type of people that we need to deal with? You have some type of immigrant population that needs help. You have people that were in situations where it's very difficult, because of societal things or to them. But as a person of color, seeing other people that look like me, I think it makes me more sensitive to what they're going through. Not to say that people that don't look like me aren't as sensitive, right? But that's just what I bring because of my history. And I know I have my parents looking at me and I feel like they're saying, and my ancestors looking at me and say, we're giving you all this knowledge. We're giving you all these skills. What are you going to do? Got you. What are you going to do? How are you going to work with your sisters and brothers to make sure that we're helping everybody? Because that is the goal of what we're trying to do. Help the next person. Just help one more. Every time is just one more. Just give me one more. So that's what I feel that being a Black man in this particular role brings, and that's kind of what drives me.
All right, a quick question and just spit it out really quick. What do you think holds people back from accomplishing their goals?
Fear.
Fear. How to overcome it? Is it in the process that you talked about early on?
Fear in what the unknown. of the unknown of what's out there, but also what levels they're willing to go as an individual or their capacity. What is my capacity? I'm here to tell you, you have endless capacity.
Okay.
You have endless capacity. Just believe in yourself. Take a step out. Some people are scared to say, okay, maybe they're at an organization where they're not, really feeling it, but to take that step out. They're even scared to just tell people that they're available.
Yeah, that part.
So,
yeah, that part. Yeah.
like, yeah. Sometimes I did it. I took it out, and
Right.
I had to say, wasn't all the organizations I worked at being fantastic are fantastic, but there was just a time in me that I need to grow. And so
Sure.
put yourself out there. Don't be afraid. Invest in yourself.
Okay.
Invest in yourself. If you're at a place and you've been there for a long time, you're saying, man, I'm stuck. Invest in yourself. I was when I fellow for American College of Hospital Executives. That was investing in myself. That showed me that I had some knowledge that I had not known about healthcare. It rounded me more as a professional. It actually made me better for this job because I was at the other job that I was at, and I was like, how can I grow? Well, start getting more education. Start getting more skills, and you will lose that fear because you'll have a skill set. The unknown now becomes known. What's going on over there? Not essentially, if you research what is going on over there, you feel better about accessing that, and you feel more confident, and that'll come out in the interview, and you start to get those positions. So don't let yourself hold yourself back. You are the change that you need. You are. There's a great Nike commercial I can show it where this guy is basically running down a road by himself and he's having a conversation. One side is telling him to stop, don't go any further.
Right.
The other side saying, I got to go further. I got to do it. And it's like he's having this battle between himself.
Sure.
And the side that wants to keep going says, I'm not going to listen to you anymore. And he starts running. And so the other side's like pleading with them to stop, but made the decision, I'm going to keep running. And he just runs off down the road. And that's how we got to be sometimes. We are our own worst enemy.
That's a great story. Thank you for sharing that. So let's look back really quick, and I want to make it quick. This path to your success you are today, it's been phenomenal. Thank you for providing that insight. But as a kid, what did you think you wanted to be?
Oh man. Oh, you're taking it way back.
Yeah. What did you want to be?
Yeah. Oh, you know what? I'm gonna tell you. And I think this is what it is. I want to be like an astronaut.
Really? Okay.
I am enamored with space.
All right.
I really like black hole. I remember the first kind of space movie my parents took me to was Disney's Black Hole. And I thought that was really cool with the laser guns and stuff. My favorite ride at Disney World was Space Mountain.
Okay,
and
yeah.
I've always been enamored with space. Was going to be on Star Trek.
Wow.
And I'm still right now. Oh man, the universe is just so magnificent. It's so huge. And we just, we're such a small piece.
Right.
But it's always thinking about science and how even the science that we've proven on Earth mathematically. And one of my favorite persons, by the way, is Neil deGrasse Tyson. Okay. And I watched Cosmos just like he did, and now he's a physicist. But it's just how space and how there's stuff that works on Earth, and it works mathematically on Earth physics, but it also works in the universe.
Right.
So the fact that we're so small and so physics was already there, but we're connected to that now, and it actually can be proven. Like not just recently, we saw a black hole for the first time, but we had known about it and through mathematics, 20, 30 years ago, even further, maybe 50 years ago, in Einstein's theory of relativity. So all these things I think is magical.
It is.
As a kid, I would want to be an astronaut. My father worked for McDonnell Douglas. He was actually an engineer, and he designed a piece of the space shuttle Columbia, and the engines in the back. So I always had the designs, and I would have the rockets and stuff.
That's cool. So I was looking it up a couple of weeks ago with my granddaughter, and we looked it up. This was an interesting fact. 1 billion Earths can fit into the sun. Isn't it crazy? 1 billion Earths can fit into the sun?
We have no, thank God it's so far away.
Exactly. All right, so
and it's loud.
As we sit here on Earth, are we looking up into space or down?
Well, you know what?
Yeah.
So the question is, what are you using to orientate yourself?
Oh, okay.
Like that is so when you talk about on Earth, we use the poles, north and south. But in
Right.
space, we're not necessarily north and south of anything.
Oh, yeah, true.
And now, the theory that as a system, we're moving. So remember back in the day, for way back in the day, they thought everything revolved around the Earth. And
Right.
somebody said, no, that's not right. So they finally figured out everything revolves around the sun. Then so you got this solar system that's revolving around the sun. Now I'm gonna throw in that all of that stuff is moving through the solar system at breakneck speed. So now we're revolving around the sun, and the sun's actually in motion, and we're going around the galaxy. And
Wow.
then the galaxy itself is in a cluster of a million other galaxies, which is another cluster of a million. I mean,
That's a lot.
that the galaxy, that the universe is expanding, and it's expanding so fast that it's expanding faster than the speed of light. So there's some parts of the universe where we'll never see because the light will never reach us ever.
That is insane. So as we begin to wrap this up, I definitely got, because I want to be respectful of your time, I definitely got a couple more questions. So bear with me really quick. So what you shared a little bit, about the impact that you make, but elaborate a little bit more. What impact are you trying to make, and what message are you trying to leave the world, man? So we can vibe with you.
The message that I'm trying to leave is, if we all work together, we can save the next person. Wherever you're at, whatever vocation that you're at,
Okay.
humanity is our greatest gift that we've been given. And how we serve each other, how we protect each other, how we work with each other, how we love upon each other. To me, you just just give me one more opportunity to impact somebody's life, because that one that you impact 10 years from now can turn to 30 people. They'll go out and impact somebody. Then those 30 people go out and impact somebody. So now you have multiplied your footprint on this small blue dot that's going around the galaxy.
Right.
And as a human race, we get better. And if we get a critical mass of that happening, man, we can turn this into a utopia. Hopefully I'm alive to see that. And bounce my grandchildren on my knee and talk about how things used to be when we had rotary phones and
Exactly.
test tapes, Blockbuster.
Powerful, man. That is really powerful. And, in the bio, I read about some of the things you like to do extracurricular, but outside of work, outside of, wearing that hat as CEO, what things you like to get into? Where can we find you being happy at?
Well, besides, loving on my family and kids and my relatives, I really like, I've always been a gamer. Said my dad was real instrumental in taking me to programming class at a very, very young age. I remember sitting when they first came out with the first computer, being like a kid in this group of older men, and we're sitting there watching somebody program, how do you change the color in BASIC? And that was the whole thing. We used to go at night, and I had this basic programming book. And I remember the first computer that we bought, it was an IBM XT.
Okay.
And it wasn't even in a store. You had to go to this contractor. They said, well, how you want it configured? And I was like, well, give me the IBM XT. He was like, give me the 1 megabyte hard drive. And we were like, well, we're never going to be able to fill that up.
Exactly.
We'll never, 1 megabyte, 1,000,000 bytes, we'll never be able to fill that up. And then you're carrying around these devices. Now, my phone has 50 gigabytes.
Right. Exactly. Right.
But so I've been into computers, video gaming for a long time. I do that. My son's a gamer, so we challenge each other, and it's generational now. So now I got to show him how we used to do it, back in the 80s. And so it kills me every time, but it's fun. And I like to watch movie. I'm in the theater. I like my favorite play is Phantom of the Opera. I like operas, and I used to play the violin, so I like the symphony. I like music. So those types of things you're talking about, kind of pulling yourself away.
Yeah.
When I get immersed in an environment of a opera or a musical, or going to see symphony, or binge watching horror or whatever, I read Stephen King. Those type of things is a way for me to escape, and so I like doing those when I'm off.
Listen, man, I've really, I'm just going to keep saying really, because it's an easy word to say and it sounds fun to say, but I really enjoyed getting to know who you were personally as well as professionally, and the impact that you're trying to make. I know other people, man, when they listen to this or watch this, they're going to want to know how they can tap in, be in your circle of influence. So do you got like a podcast or socials that you can that people they can link up with you or follow you in your journey?
Well, I'll tell you what, I've learned a lot from you as an influencer. And I do have some, I do some blogging on LinkedIn of the events that happen at my company and with my organizations that I'm a part of or supporting. And so the best way to contact me or see what I'm doing is on LinkedIn right now, and that's really, showing what's happening where I'm at. And I've had the gift of being awarded a lecturer position at University of Virginia. And I interact with those students and they better. They have made me a better administrator as I'm teaching them management theory. So you can find me there as well. But LinkedIn probably is the number one place that brings all that together.
This is awesome. I know other people is going to be hitting me up after this, wanting to get in contact with you, commenting on the episode. This was really impactful, very eye opening. And I like that there was a lot of different layers because I think there's stigmas that we have in our head of what an executive look like in a healthcare system, especially a Black executive, and the things that that they find of interest outside of work. You talked about Phantom of the Opera and being a violinist and going to Europe and smoking cigars and
Yeah.
having your brandy. I mean, these are things that make you, a lot of people think you wouldn't get into. So I appreciate you just being open and honest. And with that being said, I'm going to wrap up this episode, man. Listen, thank you, hustlers, for tapping in. Thank you for joining this episode. It was very inspirational, very eye-opening. Today, we had an opportunity to connect with Herron Mitchell. And again, Herron Mitchell, he's the Chief Operations Officer for Foremost Family Health Centers in the Dallas-Fort Worth Metroplex. You make sure you tap in with him on LinkedIn, follow his journey and the impact that he's trying to make. Until next time, hustlers, let's get it. Let's keep hustling.
All right.